Hello, my name is Dr. Katie Palmer, and I'm a physical therapist here at Performance Spine and Sports Medicine of Newtown, and I'm here today to discuss the benefits of kinesiotape and how it might be a treatment plan for you. So to get started, what is kinesiotape? So kinesiotape is an adjunct therapy that we use within a regular physical therapy program. It is a therapeutic taping technique using a particular type of latex-free elastic tape. It does not contain any medicine, and it can be used for a treatment of a wide variety of dysfunctions as well as injuries. So a lot of my patients came in after the Summer Olympics asking what type of tape these athletes were using. So like on Serena Williams and Misty May, we see the tape on different parts of their bodies. So that's when it became really popular, but it actually was invented back in the 1970s by Dr. Kenzo Kase and used in Japanese rehab hospitals. So it's used for both athletes and non-athletes alike to treat a wide variety of conditions, including tendinopathy and tendinosis, sprains and strains, myofascial pain, and other types of conditions such as chondromalacia, IT band syndrome, carpal tunnel syndrome, lymphedema, and swelling. So how does this little piece of tape work to help with a lot of these different types of conditions? So what the tape does is it lifts the top layer of the skin from the middle layer, and this allows for better lymph drainage through the skin. And when you have better lymph drainage, the more lymph flowing through your body, the better healing can occur. So more space allows for better communication between the injury site and the brain, and this leads to greater muscle performance. So these lymph channels assist in the healing process by allowing for the removal of chemical substances and fluids in the muscles. If this lymph flow is restricted, then this can lead to swelling or congestion in the area. This swelling can lead to an increase in a pain response and an inefficient muscle use. So what the tape does, it allows for space and limits this congestion. This allows for this better communication between the injury and the brain. So there's 6 basic concepts of how kinesiotape works, or what you can use it for. And there's not a set protocol for each of the concepts. So the first ones are the facilitation or the inhibition of a muscle. You can also use it for mechanical correction or space correction. You can also use it for fascial correction, tendon ligament correction, or circulatory and lymphatic drainage. Again, there is not a set protocol, but it's usually based on the symptoms and presentation of each patient, and this is determined by the physical therapist or someone who's trained in the kinesiotape method. So the first basic concept of kinesiotape is for the facilitation or inhibition of a muscle. This depends on the direction of the tension that's placed on the tape. By facilitating a muscle, we're providing sensory stimulation to assist it, or we can provide the sensory stimulation to limit the use of a muscle. So one of the ways that we use tape in this way is for an Achilles tendinosis. So the first part of treatment for an Achilles tendinosis condition is to rest and decrease the use of the calf muscle, which is connected to the Achilles tendon. The Achilles tendon attaches to the muscle of the heel, and by taping the calf in order to limit the use of the calf, then we're helping to allow for better healing process while the patient is resting. So the second basic concept of kinesiotape is for a mechanical correction. So a mechanical correction taping places a joint in a corrected position. This corrected position improves the biomechanics of a joint and allows for better use and decreased pain for a patient. So one of the examples why we would use a mechanical correction taping is for somebody with a rounded shoulder posture. So along with postural correction exercises and a lumbar roll, a patient may find relief in pain if they're using a kinesiotape mechanical correction to help pull their shoulder back into the correct position. And according to research, this can also allow for a greater pain-free shoulder range of motion while the patient is going through therapy or even when they're not in therapy at the time. So the third basic concept of kinesiotape is for space correction. So a space correction taping helps to decompress a tissue and opens up a space to allow for that increased lymph flow that I talked about earlier. So an example of when we would use a space correction taping is for carpal tunnel syndrome. So for the carpal tunnel syndrome, you're placing the tape around the hand where the carpal tunnel lies. And this can decrease the pressure in this small space where tendons, nerves, and blood vessels run into the hand. And that helps with pain relief for the patient. So the fourth basic concept of kinesiotape is for fascial correction. And the fascial correction taping directs or creates movement in the fascia and helps to improve fascial movement. By improving fascial movement, we're in turn improving the muscle function and the flexibility of that area. An example of when we would use a fascial correction is for a patient with IT band syndrome. So here, you're placing the tape over the IT band to oscillate or move the fascia. A lack of mobility in the IT band can cause knee pain, so you can use this in a patient who's having knee pain. So the fifth basic concept is for tendon or ligament correction, and a tendon or ligament correction taping can be used to protect a tendon or ligament that has been injured. So an example that we use this type of correction taping is in a patient with an MCL sprain. So our last basic concept of kinesiotape is for circulatory or lymphatic drainage. And what this does is it helps to pull the lymphatic fluid from an area of more congestion to an area of less congestion. And an example of when we use this is for post-operative swelling. So a lot of patients after a knee replacement or after an ACL reconstruction, we will use these web cuts for lymphatic drainage. So how is kinesiotape different from other tapes? It's not used, like I talked about earlier, it's not used for mobilization. So what we most commonly associate with taping is white athletic taping. So with the white athletic taping, we're using that mostly for immobilization. So kinesiotape is not used for immobilization. Kinesiotape allows for normal joint movement because of its flexibility. It is latex-free and there's less skin sensitivity. So what this means is that we can use it in a wide variety of populations. So we can use it in pediatric patients all the way up to geriatric patients. And it also improves circulation to decrease pain. So, like I said before, the white athletic taping or even McConnell tape, that's not going to do anything to increase the circulation. The kinesiotape allows for that improved circulation in order to decrease pain. So just remember, kinesiotape is always used as an adjunct treatment and it does not replace traditional physical therapy or rehabilitation. And to ask your rehab specialist trained in the kinesiotaping method if kinesiotape is right for you. And if you have any questions, feel free to call at 215-504-2223 or email me at the email address listed above. Thank you for your time.